I gave birth to my two sons. None of them have ever taken baby milk.
What were you taking?
Pap.
Kid me now.
Better pap. Good pap. And then from their milk, plant-based milk, you give them egg, you give them meat. You cannot look at the way children are coming down with different kinds of cancer these days. You cannot.
Children?
Yes. Leukemia. Go to Lutz. Go to Lasut.
Hi guys, yes, welcome to another episode on the Truth Podcast. My name is Chidima Ibe, and with me, I'm not alone. I have a guest, the first one and only fruit clinic in Nigeria. She's the first fruit nurse that I know. I don't know about you, so I'll allow her introduce herself. Hello.
Hi.
Let's meet you. What's your name?
Thank you. My name is Choma Okonkwo, and people call me the fruit nurse. I'm a registered nurse. I'm a doctor of naturopathic medicine. I'm a holistic coach.
Okay, period. You see that I did not even go half of what she can do. All right, so today we're talking about a very interesting topic. We coined it to be cancer is now the new malaria. I know it's sounding like I beg you, but the way people are dying of cancer these days and contacting cancer, it is alarming. So the first thing I want to ask is, what causes cancer?
Okay, so when it comes to cancer cells, when it comes to cancer diagnosis, there are so many factors, that can contribute to being diagnosed of cancer. Some people will say, oh, if you have it in your gene. Some people say, oh, it's genetic. But now, cancer is now beyond being genetic. Cancer can be caused by your lifestyle.
Tell me
from
about
your environment. So for cancer is just the name. Every other disease can be as deadly as cancer.
Yeah.
And we've categorized it that it can be caused by just two major things: deficiency and toxicity.
Deficiency of what?
Good. So deficiency of nutrients and minerals that the body needs to function properly. So you find out that deficiency can be as a result of your poor diet, your poor water quality, your poor environment, because if you're in a toxic environment, you might not be able to inhale good air. Okay? And then for the toxicity, that can be as a result of the environment you find yourself in, the things you put on your skin.
Very important.
Aside from that, hormonal therapy, our drugs, our medications are now predisposing us to having cancer. Because your medication can actually be toxic
To your body.
Yes, because it's made up of chemicals. And these days, any little thing, everybody just want to take this medication. People just want to, even the ones that they prescribe and the one that they do not prescribe. So at the end of the day, you find out that cancer is just the word. The lifestyle is what actually predisposes you to having cancer or any other health problem that is even worse than cancer itself. Yes, like this one, like lupus, autoimmune disease. There's a particular kind of disease that is called lupus, where your body is fighting against your body.
Whoa.
Oh yes.
There's one I heard that some people react to their own sweat.
Yes. That is just it. It's still part of the lupus thing we're talking about, whereby what you are actually your antibodies or your antigen, your body is recognizing your body as an enemy.
Woo!
Yes. So at the end of the day, you find out that everything still boils down to lifestyle, because we have situation whereby there are some people that have the how would I put it? They have cancer in their gene, but because they understood the role of lifestyle, they were able to live longer and were not diagnosed of cancer compared to people who did not even have it in their gene
at all.
But they started eating wrong, they're doing everything wrong, maybe as a result of ignorance. At the end of the day, you find out that these are the people that are now being diagnosed of cancer. And then people are saying, but it's not in our family. Yes, it's not in your family, but you used your own hands ignorantly to introduce it to your body.
Oh, we have a long way to go. What are the most common types of cancer in Nigeria today? I just want to bring it home. In Nigeria, what are the common ones you've heard of?
Okay, so I came back from Canada like about 2 weeks ago, and I was shocked. I was really shocked. And the fact is that the three most common type of cancer now in Nigeria is breast cancer. This is according to research. Prostate cancer and colon cancer.
I know about the first two. What's colon cancer?
Colon cancer is actually one of the I think the only cancer that is directly related to what you eat. Is a kind of cancer that affects the colon, the guts.
Okay.
Do you understand? Yeah. So the colon is just part of the digestive system. So after the large intestine, after your small intestine digests, absorb your food, gets to the large intestine, form bulk for you to be able to defecate. So that rectum, the colon, the anus, all those things, we have the ascending colon, the descending colon, the transverse colon. They are all part of the large intestine.
Kill me. You know, as you're calling all this name, I'm like, hey, I thought I'm done with chemistry.
Chemistry and biology.
Oh my God.
Yeah. So when you see people when they eat food that are very low in fiber, the peristalsis, which has to do with the movement that has to do with your small intestine and large intestine, is drastically reduced, then you see these people predisposed to constipation.
Yeah.
Chronic constipation. They strain. So it gets to a point whereby your body can't take it again. So inflammation gets in. From inflammation, you start seeing things like growths. That's why you see people say, oh, I have pile, I have constipation. It's not a good thing. And the beautiful part is that colon cancer is that cancer that can be 90% prevented.
But can it be treated though?
Yeah, so when it comes to cancer and treatment, there are there are so many theories that are available now. So the regular or the most popular treatment for cancer is the chemotherapy, the radiotherapy.
But I heard it's not even
so because of the side effects, because the way this thing works, it doesn't just destroy the cancer cells, it also destroys the normal cells. So but we now have a new aspect of medicine called the integrative medicine, where we can actually combine modern medicine and natural medicine, also known as alternative medicine. And the alternative medicine, where nutrition comes in. So yes, colon cancer can be treated if they get the diagnosis early enough, and if the treatment option has to do with integrative medicine. Because the mistake we make in cancer treatment is that everybody want to get the glory. The doctor wants to say, oh, I am the one who did it. The nutritionist wants to say, I'm the one who did it. Nobody is putting the patient first. So the moment we put the patient first, then I think that most cancer can be cured. Because you find out that a lot of people want the cure, but they don't want other people to come to it. Exactly. Because why should a cancer patient be treating cancer with chemo and you are telling that cancer patient that they can eat anything? And then because they believe so much in their doctors, their nurses, you find them taking fizzy drink, you find them taking things that are not high in fiber. I had a patient, because I work with professors in oncology. I had a patient that was diagnosed with colon cancer. He has been going to the teaching hospitals. There was nothing to be done for him. He was having chronic constipation. He was always in pain. Somebody saying 1 week without defecating.
Wow.
All we did was just to change his diet and introduce high fiber food. Guess what? It didn't take up to 24 hours. He started using the toilet every single day till now. So that kind of patient, if you now integrate medicine, bring in the professor in oncology and maybe place him on chemotherapy medication on very low doses with their nutrition, tell me why that patient will not survive. So the problem we have in Nigeria is the gap in education. And nobody want to collaborate. Healthcare will not survive again with just modern medicine. It's high time that the modern medical practitioners start collaborating with the natural part, the holistic nutritionist, especially the licensed ones that knows what they are doing. That is the only way cancer can be cured.
Wow. Please, that's why they say prevention is better than cure. Because all this plenty English and big grammar you're speaking. God forbid, I don't want to know it. I don't know it, and I don't want to know it, because sometimes tell God to just pray not to have, not to know some things, because it's too much.
It's much.
My next question would be, how does cancer incident rate in Nigeria differ from other developed countries? I mean, I thought cancer is a universal word, general thing. Are there different treatments and different things for different countries?
Okay, so basically, just as I said, I've lived in Canada for like almost 3 years now, and I've been privileged to get to know how their healthcare system works. So these people put prevention very, like, they are so keen on prevention. They are so keen on preventive medicine. So they made it like mandatory for you to check. So they are able to detect this thing on time. So when it comes to the prognosis is just like the results, like, how will I put it now? The results when it comes to cancer treatment, like the results you are going to get when you start treating something. If it's going to be 10%, 50%, 90%, the developed countries like the UK, US, Canada, they have good prognosis when it comes to cancer treatment. And that is because they diagnose it at a very early stage. Stage 1, stage 2. But when it comes to Nigeria, because of the healthcare sector and because we are not proactive about preventive medicine, you find out that it is when we are already at the end stage. That is when we go for tests, because your body gives you signs you don't want to go for checkup. There's this particular test that I started encouraging people to go to, not because they can't do other general tests, but most of the general tests we go for are clinical tests. When the diseases are already there, they are clinically established compared to your sub-health test. Sub-health is just like before something starts showing. You see, most people, they have headache, they have stomach pain. When they go to the hospital to do tests, they say, "Madam, nothing is wrong with you." They will even start referring some to psychiatric hospital, that, "Madam, it's just your mind." But this person is telling you that I am feeling this way. So I think in Nigeria, we've not gotten to that level of technology where we have machines that can really detect something at this very early stage. That's number one. Number two, we do not listen to our body. You see, in developed countries, any little thing, they want to speak to their doctor. They want to say, "Oh, I feel this way." They are very expressive when it comes to their symptoms. But here, sometimes you'll be in your house with your mother. You'll be having a bad menstrual pain. You cannot even talk. So I think the problem is late diagnosis. We're not able to express ourselves as symptoms, and we do not listen to our body.
But you know how this human body is. Sometimes it says something, the other time it doesn't say. So because it fluctuates. It's not consistent. You just feel like, oh, maybe it's stress for the month, or it's because I went through something. So, but is it okay to have like panic or try to go for checkup just because it comes once in a while, not consistent?
Okay, so no. There's something called acute symptoms and chronic symptoms. Acute is just something you feel within less than 3 months, something you've never felt before. It just come once and that's the end. That is why when you take medication for relief, they'll say, "Oh, if you don't get better after 3 days, see your doctor." But sometimes when we don't get better after 3 days, we still don't want to see our doctors. Stubbornness. Now, for chronic symptoms, these are the things that happen between, let's say, 3 months to 6 months. You've been consistently feeling this thing. It comes, it goes. But for the long term, you can actually remember, for the 6 months, 3 months, 6 months, 1 year, this thing has been there. It should tell you that something is wrong. You need to do something about it. So, but people just want to manage. They don't just want to spend money. They don't want to hear bad news. People are so scared of bad news when it comes to their health, such that even after they get the news, they don't know that it can save their lives. Compared to, you don't want to hear the bad news, and at the end of the day, you still go and get the bad news, and it might be, you might not be able to do anything again.
Okay, so the both of us are Christians, and I know we love God, we fear God, we honor God. I want to ask you a question, a little bit controversial. What will you say to people that when they get sick, they prefer to surrender everything to God and pray for miracle to happen? as opposed going to the hospital and then do the normal treatment, especially when it comes to deadly disease?
Okay, so I am a very spiritual person because I am into natural medicine, and I am also a registered nurse. So I have seen things, and I've come to understand that I think people die because of ignorance. Like my people perish because of
lack of knowledge.
Lack of knowledge, yes. And you see, God is not stupid. In Genesis chapter 1 verse 29, if you go and read about it, you see when God talked about, he has given us everything, plants,
Preach it, sister.
vegetables, things for us to heal ourselves. There are other Bible verses. If you check your phone, just say Bible verses that talks about fruits and herbs for healing. Bible verses that talked about doctors and nurses. It's in the Bible. So why would somebody be sick and then you leave
everything,
your nutrition, your doctors, you leave those things, you want to go to the church? Yes, I also believe in like miracles.
Now why I ask you, because we know
I believe in miracles. See, but God has to use something to help you.
Yeah.
You know, you know, sometimes when people use my products, including cancer patients, I don't produce product without praying. When people use my product and they start giving me testimony a week after, I used to do like
something that I know.
Liar.
But you don't
yes, I don't believe now. I'll tell you why. Because when in nature those things are not meant to heal fast. They take time. That is where the power of God comes in. So when you see people come with chronic, I have seen people that they will say, oh, you just have 3 months, 4 months to live, and then they start eating right. All these things are on YouTube. You can go and check. Aside from me, there are people that have been doing it. And then when you start seeing these patients eat right, they come with testimonial. And you go back to God and you're like, God, how did you do this? Then he will now take you back to his word in the Bible. When he has said that he has given us everything we need.
Everything.
You are doing action without faith, you are doing faith without action. It's not going to work. So if you really want God to heal you, you have to go back to God.
Yeah.
And you have to go back to God's creation, which is plants.
Yes.
And that is why you see even some people that take medication, some get better, some don't get better until they start fixing their nutrition. We are made like this we are made from dust.
Yes.
So you cannot separate yourself from the earth. You keep seeing yourself taking chemicals, you're not going to get better. So if you really believe in God, you are sick. These are for people that will go to church praying. God can heal you, but God needs a channel to heal you.
Otto, finish, period. We end at that. Because I don't know, it's just like praying to God to give you help or to help you. God cannot come down and help you. He will send someone to help you.
It's just like one amazing like popular Pastor Jerry Eze. I was watching an interview when people were asking him all those miracles are they verified. He told them that even in the hospitals, like you will see that these people are in the hospital taking treatment and praying to God. Do you understand?
Yes,
so there must be a channel. It could be that the water you are drinking, some people will say they fasted for 40 days and their cancer reversed, and I believe it.
Yes.
Do you know the healing power of fasting? The healing power of just water fasting alone can heal the body of any kind of disease. Now imagine fasting and praying. So it works, but it will not work without a channel. It can't.
Woo, we're going to the Bible. We're going deep. Okay, so now what are the main challenges in addressing cancer in Nigeria? First of all, I want to say this. We Nigerians, we are so religious that we always say it can never be me.
Yeah.
That's the biggest problem.
Yeah.
When you say it can never be you, when it will become you, you will not even know.
You will know.
So that's why we don't talk about some things, because we never ever believe it can happen to us.
Yeah.
So what are the challenges that we have in addressing cancer?
When it comes to addressing cancer, number one challenge is knowledge. Because knowledge is power. I'm a registered nurse, and I can tell you that whatever I know today was because I decided to seek knowledge. And when I tell people that I work with professors in oncology, that is because even with my knowledge in nature, I still believe in modern medicine. Because there is a place where nature stops that modern medicine picks up. And there is a place modern medicine stops that nature picks up. So you can't separate it. So knowledge. The people in modern medicine, they don't want to be open up to knowledge. In nutrition, in spirituality, in mental health, all these things affect people who have been diagnosed of cancer in terms of their healing journey. And then we, the naturopaths, we, the nutritionists, the holistic therapists, we are so ignorant to think that we cannot collaborate with people in modern medicine because we don't have the knowledge. Some of us don't even have the knowledge about human anatomy. When you understand that the body is so complex, you will know that there are things only you cannot do. So that knowledge gap is one of the major challenge. Then, aside from the practitioners, the patient. I read a book. It's called How to Starve Cancer. And the woman was talking about her story, and she said that the most obedient patients are the ones that die. Yes. Like the obedient ones, the ones that don't question their doctors, their therapists, they are the ones that die. But you see those ones that want to seek knowledge. Why are you giving me this? What is this going to do for me? I know in Nigeria some of the doctors say, why are you asking me? But ask first. So these patients that challenge their healthcare providers, they are the ones we see, the stubborn ones are the ones that survive it. Why? Because they have knowledge
of it,
of what they are treating. You have a health problem, tell your medical doctor, tell your nutrition to educate you about it. That's why it's good to pay for consultation. When they say pay for consultation, nobody's trying to rip you. You can use the opportunity to ask questions. So knowledge gap. So in terms of the patient part, knowledge gap. In terms of the practitioners, knowledge gap. So that is the single most effective, like that's the only thing I can pick out, because when you have knowledge, you will make better decisions for both your patient and also for yourself.
Now, when you said that we don't question people that die fast are people that are too obedient.
Yes.
I remember when when I was still in university, I was having like pain on my stomach. So my mom took me to. My mom is she's this type. If you have headache, we are going to the hospital. She's so cautious. You know. So she took me to the hospital to run checks on me for everything. And then the doctor now said, oh, that I have ulcer. My mom said, oh my God, Chidima, why have you not been eating in school? Then Dr. Aaron went and said, you will not eat no pepper, no coke, no this. As my mom was driving out, I bought coke. I think, my mother said, I said, ready. Now, see, I don't have ulcer anymore. I'm telling you, I did opposite of everything. I can't even eat without pepper, first of all. What are you saying? But I mean, don't be like me.
Don't be like her.
Don't be like me. But, you know, I understood some things. The knowledge you said, I understood that when you have ulcer, you have to eat fast, eat early.
Eat early.
I'm not a breakfast person, but at that time I started eating breakfast. I started drinking enough water. You know, there's some things I just did differently. But you can't stop me from eating pepper. I'm sorry. All right, let's go. How does lifestyle contribute to cancer risks in Nigeria? I think we've been talking about lifestyle.
We've been talking about it, but I want to lay emphasis on things that, because some people eat healthy and then they do the wrong thing when it comes to their skin health. So lifestyle can be in form of what you think, what you eat, what you breathe. So when it comes to what you think, unforgiveness.
Ibiakwa, you came for the head.
Yes, cancer.
I be on my own, you can't choke me.
So when it comes to cancer, is a metabolic disease.
I wanted to ask that is it true? Because I heard somewhere that if you're sad or depressed, it introduces sickness to you. Like, is it true?
Yeah, and I'm going to explain it here. Unforgiveness, sadness, like unfulfilled life. When I started consulting with women with breast cancer, I had to go deep into their marriage, into their life, and we found out that 75% of women dealing with breast cancer had issues in their relationship, unresolved issues. Yeah. So when you are angry, when you are bitter, when you don't let go, what you do is you increase your cortisol level. Cortisol is one hormone that actually causes inflammation. It's being released when you are stressed, when you are depressed, when you are angry, when you are not at peace with yourself. So when you talk about lifestyle is beyond what you eat. So if you like juice all the grains you want to juice, and you still you don't have peace, you've not forgiven, you've not let go, your body is going to fight against your body. So that lifestyle, you need to forgive, you need to be at peace. Then when it comes to diet, you see people, when you ask how many of you have eaten vegetable or fruits this week, most people will tell you that no, aside from rice, yam, indomie yam, rice, yam, bread. bread. In fact, that is why the incidence of colon cancer is on the rise, because it's not like bread is bad. If you bake your homemade bread without bromates, one particular ingredient that is not great for the health, that people who make bread add to it. If you make your bread at home and you eat enough fiber, you see, your colon cannot be healthy without fiber.
Okay, so we keep talking about fiber. Can you give us examples of fiber food?
All your vegetables, your ugu, your water leaf, your bitter leaf, your spinach, your all categories of vegetables are very high in fiber. For your fruits, your cucumbers, any fruit in season now, the secret is don't even stress yourself. Any fruit in season, eat it. I heard there is golden melon now, there is mango, there is soursop. I bought soursop the other day. Eat those fruits in season. That is the only way you can be healthy. And fruits are very high in fiber. Very, very high.
Thank you, my dear.
Corn now. Let me tell you one shocking thing about corn that people don't know about. Corn is one food that contains a lot of fiber. And it drastically reduces the risk of colon cancer.
Thank you.
Like drastically reduces the risk of colon cancer. Your colon cannot strive without prebiotic and probiotic. And all these things has to be gotten from your fiber, either fermented or not fermented.
Which one be pre and pro? Oh God!
No, so probiotic is just like fermented food. So it helps to feed your guts the good bacteria, and all these actually help your gut health, including your colon health. Now prebiotics are they feed the probiotic, so their probiotic needs prebiotic. Do you understand?
They work
So
hand in hand.
and again your colon too needs all those things. So these are the things you can find in either fermented food like pap, yogurt, and then corn. You get. So we are still on what are the lifestyle
That
they can do that can help prevent cancer. So we talked about emotions, that's why we talked about forgiveness, we talked about diet, eating food that are high in fiber, reducing your processed food. You cannot be eating hot dog, pizza all the time. This thing, they are going to kill. The truth is that whether you listen to
me... Are you saying my eyes don't
come from I'm telling you, my sister. Even if you find yourself eating those things, you need to also remember that your fiber. That is why you see people in the village, the people who we claim are poor. They are living longer. The one living longer. Why? Because they don't have money
for processed food.
I was telling somebody that when I gave birth to my two sons, none of them have ever taken baby milk. Pap.
Kid me no.
Better pap. Good pap. And then from their milk, plant-based milk, you give them egg, you give them meat. You cannot look at the way children Children are coming down with different kinds of cancer these days. You cannot.
Children.
Yes. Leukemia. Go to Lutz. Go to Lasut. You're the one. You want to claim you are a good mom. You are the one that will give your child animal milk. We are the only mal that takes another mal milk. Have you ever seen a goat drinking elephant milk?
No way.
But at our age, you want to still be drinking milk. You are giving. You're not breastfeeding your child. You are replacing. Yes, we understand that there's some mother that cannot lactate.
Yes.
But you can. And then instead of you to use that opportunity and help your child, you are buying different things that you don't even know where
the source.
In fact, you don't know the source. So you end up giving your child chemicals. You end up giving them sugar milk. You end up giving them beverages that you do not even check the content, that the sugar level is so high. You still be the one that will give them ice cream, pizza, because you want to be the best mom. I know it might be as a result of ignorance, but today you have to stop.
Yeah.
You need to start looking at how to give your children whole meal,
balanced diet.
Fruits are there, vegetables. So you cannot do without good diet.
Okay. As we round up.
Hey.
Oh, you came to talk to me. It's fine. But yeah, there's something I want to say. It can be a form of advert, but yeah, I want to say this. The reason why we introduced in my business, the reason why I had to introduce a sister brand called Refresh Me, which is a wellness drink brand for just fruit fresh juices, is because, of course, I know I own a spa and a skincare company, but a lot of people want to glow, want to revive, want to revitalize without adding fruit.
Yeah.
And I think this is the first class of getting everything you need, both glowing skin, both a healthy body, a revitalized body, rejuvenated body. Fruits just vibes you up. And most of the doctors, that's what they use for their medical. These people that produce
pharmaceutical industries.
So if you're looking for how to get how to be able to introduce or add up fruits, inculcate fruit in your diet, you can patronize us. Refresh Me. Our juices are freshly squeezed, no sugar, no preservative, no external anything, no water, just for you to glow up. Not even just glowing up, to prevent cancer. So we're rounding up, so please just tell us one thing. There's one more question here, but I don't know if we have time. We talked about how environmental factors and pollution help to contribute to cancer. Can you say that in 1 or 2 minutes so we just round up?
Okay, so in Nigeria now, everywhere you go to, everyone is using generator. The environment is so toxic, carbon monoxide everywhere, and this thing pollutes the air that we breathe, and it can actually cause your blood to be acidic in nature, because the blood is supposed to be alkaline. So and cancer does not strive in an alkaline medium. So when you see yourself inhaling this thing, even the air, you see people have actually cut down all the trees that we have to build houses. So you find out that we are not getting pure oxygen or air. Let me put it that way. So you find out that, and you can't live without good air. So you find out that aside from cancer, a lot of people are sick. They don't even know why they're sick. And that's why you see some people, when they change environment, you see them become stronger. So when you don't get in good quality air, you find out that you're always tired. You're always weak. And that is where exercise comes in to help yourself. So that as you are inhaling those bad things, your skin, through exercising, is helping you to just detox. And exhale them.
I know that if you've seen it till this point, you have learned a lot, because I, for one, I'm changing my diet, I'm changing my lifestyle. I'm forgiving now. I'll start forgiving people, because I don't want to be sick.
Please,
and because forgiveness is for yourself, not even for the next person.
I'm telling you.
So thank you so much for coming. It took us a lot to bring her here. We flew through how many seas to bring her here. So when you watch this, please follow her on all her social media handles.
So Fruits Clinic _NG on Instagram, then Fruits Clinic Nigeria on Facebook and TikTok.
My TikTok. So you already know we're The Truth Pod everywhere: Instagram, Spotify, YouTube, Facebook, TikTok, everywhere. Please share this, comment, like. Thank you.